Good evening, dear viewers, and welcome once again to another episode of QTV Avenue every week by myself, Dr. Abubakar Jah, and my colleague Khadijatu Jallo. Today we really have a very important topic to talk about, and I just want to remind our viewers that this is a health program, and we want to give a holistic discussion about health. But like many in society, there is one part of health that is sometimes neglected by people, and we are also guilty, Khadijatu, of neglecting sometimes that part of health. I know that we've talked about that part of health in several occasions, but we don't talk about it that often. I just want to remind people that we have told you here that the WHO definition of health is a complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, which means that for somebody to be termed healthy, you should be mentally healthy, you should be physically healthy, and also your social health should be intact. Just like physical health, mental health also has stages. You can be physically, people can look at you, you have a subtle physical illness and people may not notice, and people also do have mental health issues that are so subtle that sometimes it may not be noticed. It's not just the person who is crazy and moving around in the streets naked that is mentally challenged. Many people have mental challenges and they can't come out with it, and like many other diseases also, there is some stigma associated with it. So today we are very delighted to have two experts in the field of mental health to talk more about this topic, and I am sure it is going to be an exciting program. But before we introduce them, we're going to just open the program with our Mandinka and our wall of speakers. Mbokk yi ñu ngi leen a nuyuwaati fii nii ci seen programme yi Health Link bi nga xam ne man Dr. Abubakar Jah ak Khadijatu Jallow ñoo leen ko di indil fii nii lundi bu nekk ci ngoon di waxtaanee seen wérgu yaram. Tey nag ñu indil leen beneen waxtaan bu ama am solo, parce que mbiri wérgu yaram niñ leen ko faram-fàccele woon mooy ne wérgu yaram nekkut wérgu yaram yi yaram bi rek, xel bi ci la bokka, sa jëflante nit yi tamit wérgu yaram war naa nekk war na cee feeñ, te noonu la ko mbootaay WHO waxee. Mu nekk nag loo xam ne lu war a seetlu la, because am na ñu bëri ñoo xam ne seen wérgu yaram mutut, nekkut ne dañ am jafe-jafe ci seen yaram, waaye jafe-jafe bi ci xel bi la nekk. Mel ni yeneen feebar yëpp yuñ dee di waxtaanee, feebar daf dee mun a nekk si nit, feebar yaram sax mun naa nekk si nit, kenn du mun a seetlu ne kii nii am na feebar yaram. Feebari xel tamit mun naa nekk si nit te kenn du xam ne kii nii am na feebari xel. Nekkut ne rek ñi nga xam ne ñooy dox ci yoon bi soluñ yére, xamuñ lu ñoo wax, ñooñu ne ba nga xam ne wax nañ ne dañ dof, ñooñu ñoo am feebari xel. ñun ñu bari léegi nii am na si ñoo xam ne am nañ ay jafe-jafe ci seen wér-gu-yarami xel, waaye kenn du ko dee mun a seetlu. Mu nekk loo xam ne nag lu ñu war a seetantul la te lu ñu war a faj la. Tey nag ñu am fi ñaar ñoo xam ne loolu mooy seen liggéey, ñu kontaan lool pour tatagal leen ci programme bi, parce que ñun si suñ boppa xam nañ ne benn ci feebar yi nga xam ne moom lañ war a waxtaanee te duñ ko dee waxtaanee lu bëri, ñun ci suñ boppa ci télévision bi fii nii bii bokk na si mooy feebari xel yi. Bis bu nekk ñu ngi waxtaanee feebari yaram yi, waaye feebari xel yi dañ ko dee gëj a waxtaanee. Kon tey kontaan nañ ne am nañ gan yi nii pour ñu waxtaan see ñun, dinañ leen wanalee ñoom su Khadijatu waxee ba pare incha allah.
Balne mbarala Allah jati kende programme to dal takamin so tale jan QTV tele bumbato alnal badi ma Khadijatu Jallow anen Dr. Abubakar Jah. Mbadi ngol comme Dr. Bota faka nyame bi ngalun tan ko mayarin fulala so tale nan jang mel yalon koy ma bita programme o nyinto pour ka hakilol gana bulandi wayi kacalo me yalon ko kaca ku mayarin balem men kata ko hakilo nyinna kaca nyin fannala bayi modo bijele hani yatara ko sasa ba balo kono bari nyaaba tara tilendi ngala bari tatalon nako sasa ba balo kono men kama ko hakili sasa do me yalon ko wala modul bije sa fay ko comme e nyaale mata wala fe manke fenti me yalon ko mel be tama kan silo kan damma e deni kol bondi wal damma la multi yalon ko yogo soto bari modul bije le fay ben kono be do ko wala dol bije le be suwo kono bari hani wo hakili sasa nyimbe o mari lale me ya tinna ko ajeta ko ngam ko mayarin fulale so tale jamba e wato waten se yele selo kaccanse sukuro kaccanyim programme to bari comme nyin hakili sasa nyimo kulati me yalon ko jama buka kacca me ya tinna ko bulan nga luntan ko mayarin fulana tale nanja miliyalon koy bal londila menom hakili sasa nyinti anum fana nabile fana ka ma nyame annimbara.
Thank you very much, Kadiatou. Kadiatou, before we go in, I just want to give some numbers just to so that our speakers, our viewers will understand the seriousness of mental health, because WHO has indicated that 1 in 7 people throughout the world, 1 in 7 people have some mental health issue. So it is more common than we think. One of the most common ones is anxiety disorders, and there are more than 300 million people living with anxiety disorders. And depression also the same thing, more than 300 million people in the world living with depression. So it is very obvious that most people with health disorders are not catered for, and that is the importance of this. So I am really very happy here to have on my left, ladies first, Diane from the UK. She will introduce herself and tell you more about herself before we get into the program. And also near Kadiatou there we have Alaji, who is a Gambian based in the UK and also an expert in this field. So we will start with ladies first. Diane, we're very glad to have you here, and thank you very much for making time to come and speak to us about this important topic.
It's my pleasure.
So our viewers would like to know who you are and what you do.
A little bit about me. My name is Diane Hardiman. I'm a psychotherapist, a lecturer, and I work as a co-director with YS, Counselling and Training, which is Al-Haji's brainchild. And we're over here in Gambia, and we are training Gambians to become mental health counsellors. And our aim eventually is for Gambians to be teaching Gambians to be counsellors.
Oh.
And that's why.
Thank you very much, Diane. So Diane lañ njëkk am fii nii ñoom ñaar suñ gan yi wax nañ leen ne Diane mooy kenn ci suñ gan yi Alaaji moom Gambien la mu nga fële na la ci Angleterre waaye dafa day ñëw fii nii at bu nekk di dimbalante ñun ci feebar bii nii Diane nag wax nañu ne moom mu ngi liggéey Angleterre am na mbootaay bu ñu ooyee WIAS bi nga xam ne Alaaji moom moo ko sos boo xam ne ci lii lañ dee di liggéey te dañ dee ñëw at bu nekk fii nii di jàngal nit yi naka la ñoo waxtaanee ak nit yi nga xam ne dañ am feebari xel te bokk na ci faj yi waxtaan boobu noonu te waxtaan bi nekk na waxtaan boo xam ne kuñ ko jàngal moo ko mën a def ñoom nag ñu ngay jàngal nit yi fii nii te luñ bugg a mooy dem ba nga xam ne Gambien yi nga xam ne ñoo nekk fii ñooy jàngal yeneen Gambien naka lañ ko defee ba nga xam ne ñun ci suñ boppa dinañ mën a toppatoo lu demee noonu xam naa ne Alaaji moom it su ñëwee dinañu gën a wax ci WIAS naka la ñëwee ak naka la ko xelaatee waaye dinañ bàyyi Kadiatou wax ci man ni ka ñu door a meeg Alaaji mu dugg ci waxtaan bi.
Mbadingol comme Dr. Bota foka nyame même bota diamole science and tenting e ka fubole Diane mo moldi me yalon ka be Angleterre sati kono amu fenet me yan ka te specialized comme mental health wala mel yalon ko e hakili problème o soto ako abe specialized ring wala so me yatin na ko ina ta Gambia kono jangwato wati kana Gambia kono le pour ka mol karandi pour mol yalon même mental health adum fana wolom pour mol yalon ko ni atara ko hakili sasa nyimbe le fanan ini mol be kacciano wala nyaade le foka je ko se demaro soto no nyamen awatola so Diane la na ngom wolti me yatin na kay kacca kuma yari ngol sotabe men dila la na jang ala baraka.
Thank you very much, Kadiatou. So Alaji, if you can tell our viewers who you are. Alaji is Gambian. He speaks perfect Mandinka, so I'm sure that he will be able to translate for himself what he has said. So in English, you tell us, the same way as Diane, who you are, but more about your organization, WIAS, and as soon as you finish in English, you can say it in Mandinka, and I will try to say it in Wolof.
Okay, thank you very much, Doctor and Khadijatu, and also good evening to the viewers. As Doctor just said, my name is Alhaji Kamara. I am a specialist mental health practitioner, counselor, psychotherapist, and also high-intensity CBT therapist. WIAS is an organization that we set up in the Gambia back in 2018-19. That was immediately after the change of government. We noticed people coming out talking about their challenges, their experiences, and one thing we found at the time was there wasn't that much support for those individuals. So that is why, you know, as a Gambian, I thought, okay, let's see what we can do to support our people back home. So I came here, we set up this organization in 2018, and since then, we have been providing counseling services to individuals, couples as well. We do couples therapy, and also we do training. We did quite a lot of training in schools. Anytime we come to Gambia, we will go to one institution and kind of do a mental health awareness talk. So that's something that we have been working on. And also we had MOU with few ministries like Ministry of Health, Lower and Basic Secondary School, Justice, and also Women, Children and Social Welfare. Currently, we partner with the Management Development Institute, that's MDI, in the area of training. So, as I said, when we started operating, one of the gaps that we found out was qualified and skilled individuals. So, Dan was my lecturer, you know, so when I went back to, in 2019, so I had this conversation in our class. That was our, you know, final year. And a lot of interest, people supported me, and then we set this up. So since then, we have been, you know, kind of providing counseling to individuals online. And then the partnership with MDI also came about. We gave us the opportunity to start training young people, you know, to diploma, that is level 5 diploma. So this level 5 diploma is in UK, the curriculum is set in line with the UK curriculum. So if the individuals on this course, when they finish their qualification, that's because we will be registering them individually with CPCAB. So we have an accreditation for that already. We have all been certified as trainers who can train that tailor-made qualification that suits the Gambia, you know, either culturally, traditionally, and, you know, religious, because we have to take our cultural context, you know, into whatever we do. So they have finished the certificate course, and we are now, we've started the diploma, the diploma one, So when they finish the diploma, they would be qualified counselors, and they can practice anywhere in the world because their qualification is recognized in the UK.
Fantastic.
So that's where we are, and this is in the Gambia for 3 weeks. We have been having intensive skills practice with the students. They really enjoyed it.
Fantastic.
You know,
and I'm sure also, apart from these 3 weeks, you have some online courses that you run also during the rest of the year. That is fantastic. I mean, that's a lot to say. So I would like you to say that in Mandinka first, and let me see how much you say before I decide.
Okay. Yo, badiwala de coming off on yaminto mu alaji leti camera. Ntela doku mumenti wala mu nying sondeme kende ala fanala. Because jata kendea sondeme kendea ning sondom untola duko tilinta wolela so nka menke no wala munyinti ko mol mel yalan ko imman sondeme courant soto folo but ibe because yalo mental health ikatara temale ya understand ikatara is a continuum, you know, ida ye kolea kuje la mafanga komi ye miro mola miro je afalinta wala akebaro falinta, you know, then wato isi futano moluma komintolu purunsi wo mari kachandi because ntola do konko jara nyame wala munke mari kachanyo yandile pour ka jibe itela miro kono membe je because modo beje wato dulu nay kolea kudo soto aka miro soto me alon ko asi kawku asa fango jakali so ntol si mako no pour ka ajeko ilo miro mune ba koto anim fana isi muneke no mensi atinna no asi akana ke mantorode so na organisation no be lore wala la adu nga dati Gambia janne 2018 2017 kabiru mansa kunda falu keta wato le nga form an kabirin woto ani sign nka molu mako nka ne mol ka doku ke melialon ko ida mo kilin wala grupo wala melialon ko ida ila relationship kodo ida futuma nyo fululu ye kole ya ku soto je den ikana fana ne kasi nka ikachandi nka kacha fo wato menna isi kambe on soto no isi d'accord no pour ila tara nyo kan si soneano nyame anin kata nyaado.
Thank you very much, Alaji. I'll do my best, and I think you speak some Wolof so that you can tell me if I've missed anything important about what you have said. Mbokk yi ku doon wax ni mooy Alaji Camara wax na leen turam moom mu nga fale na la ci Angleterre di liggéey ci mbiri feebari xel yi mu ne nag Diane mi moom moo ko bokk na si ñi nga xam ne sax ñoo ko jàngal moom nag bu mu demee ba jeexal bu nguur gi ceeñee fii nii boori 2017 ñëw na fii nii mu sos waayas bii nii ñuy wax ni nga xam ne ñoom seen mébét yëpp mooy jàngal nit yi ci mbiri naka la ñoo fajee feebari xel yi ni nga xam ne moom la ñoo waxtaanee mu ne nag buñ demee ba ñëw lëkkaloo nañ ak Ministry of Health Ministry of Higher Education ak yeneen ministry ak yeneen organisation pour jéem a dimbali nit yi seet naka la ñoo dimbali nit yi mu ne nag bu ci gën a am solo mooy ñu ngi liggéey ak MDI ñëpp noonu lañ ko xamee mooy MDI bi nga xam ne mu ngi Kanifing fii nii ñuy faa joxe nag benn certificate boo xam ne dañoo jàngal nit yi ba nga xam ne ñoom it seen boppa seen xam-xam dina màcc ci mbiri waxtaan ak ki nga xam ne feebari xel la mu ne dem na sax ba léegi ñu ngay jàngal tamit naka la ñoo waxtaanee diggante góor ak jigéen suñu amee problème parce que loolu noonu problème yooyu dañ dee bëri Gambia tamit mooy jëkkër ak jabar ñi nga xam ne am nañ ay problème yoo xam ne mu ngay dox ci seen diggante ñu am nu ñoo waxtaanee ñoom ba nga xam ne ñoom ñaar yëpp dinañ gis benn gisin bi ba nga xam ne seen jafe-jafe yi dina wàññeeku mu ne nag depuis 2018 commencé nañ loolu noonu te léegi nii sax am na ñoo xam ne jot nañ certificate bu ees bi te certificate yooyu noonu soo ko jotee dafa mel ni yaa ngi jàngee sax Angleterre parce que ñoom mbootaay yi nga xam ne ñoom ñoo dee di wane ne certificate bii nii am na maanaa foofu noonu ci Angleterre ñoom ci seen boppa ñooy wane ndax bii nii am na mandat ndax amut maanaa comme nag su nekkee ne sax dem nga ba jàng ba jeexal jàng boobu noonu fu la neex nga dem ci di nga wane kayit boobu noonu dinañ nangu ne yow mun ngaa def façon yi faj bii nii te xam-xam la amut benn faju boo xam ne nekkut xam-xam la boo xam ne ki nga xam ne jàngu ko du ko mun docteur bi nga xam ne jàngu ko naka la moo waxtaanee yan la moo indi yan la warta indi yan la war a nangu yooyu noonu yëpp ay jàngala yoo xam ne jànga yu am solo loo xam ne nit war na koo jànga foog naa ne Alaji I have tried to relay in summary. So before we go on to ask people to call in to ask questions, I had in the opening of the program, Diane, I had tried to just give an overview of what mental health is all about, and I just want you to maybe add your voice to it and tell us more about your experience in mental health in the UK, which is one extreme, to the other extreme here in the Gambia in Africa. So what are your thoughts?
My thoughts. I've been working as a counsellor and psychotherapist for almost 30 years now. I've seen enormous changes in the UK from how I trained to how things are now. When I first started working in the UK, the stigma for mental health was huge.
Yes.
And it's very similar to how it is here at the moment. Over 30 years, it's changed dramatically. And our hope, and my hope, is that it will also change in Gambia. So, having seen changes in 30 years, I know that we can make something happen here. One of the big differences between the UK and Gambia that I'm experiencing right now are the students and how enthusiastic they are. In the UK, a lot of my students are, and I'm probably hoping they're not going to see this, but they feel totally...
You know it's going to be on YouTube. So
oh, well, that's fine. If they can see this, that's fine. There's a lot of people who are very entitled in the UK and they expect too much. They're so familiar with being able to access education, to access whatever they want. They have grants just so easily obtained to train, and almost take it for granted that it's there and it's an entitlement and a right and they don't have to work that hard. In Gambia, because it's hard, because it's difficult, the students here are remarkable. I love coming over. Twice a year we come over to teach, and all through the year we teach online. And the joy I have with meeting the students here is how it was when I was teaching. They're dedicated here, they are determined, and the key difference, students in the Gambia want to work for their country. They want to work for their people, their community. It's not all about, I want to make a lot of money, which is what a lot of people in the UK seem to focus on, but I want to do something to help my country, to help my kin. And it's very much more about we as opposed to me.
Wonderful.
And I love that concept,
That's
the whole
amazing.
idea of community.
That's very encouraging. That means that very soon we're going to have, because that's what makes experts. It's the interest and the the joy you have in working in a certain field, and so we're very optimistic then that we're going to get experts in the near future. Mbokk yi lu ma njëkk a laaj Diane mooy ne moom yàgg na liggéey ci mbir mi. Man si jëlbeen bi bëggoon naa leen a wax lan mooy mbiri feebar bi nii. Lu ma ko laaj nag mooy moom ci gis-gisam lan mooy lum gis ci Angleterre foofu nga xam ne foofu la nekk ak at yi nga xam ne ñëw na Gambia lan la gis. Moom nag wan nañu lan la gis si ñi nga xam ne ñoom la moo jàngal. Wan nañu ne foofu noonu Angleterre bu mu commencé 3 fukki at ci gannaaw nu mu meloon time boobu Angleterre noonu lañ mel léegi nii ñun ci ne nit yi dañ dee ñaawal wala dañ dee ñàkk a rafetlu ki nga xam ne dafa am feebari xel ba nga xam ne ki nga xam ne sax dafa am feebari xel du ñemeñ a génn si ne maa ngi am feebari xel. Parce que dafay ragal ne nit yi xam ko mu ne noonu la meloon Angleterre 3 fukki at ci gannaaw léegi nii ñu bëri xam nañ mbiri feebari xel ba nga xam ne ragalu te ñu génn pour wane ne maa ngi am feebari xel boo xam ne mu ngi maa gétteen te soxla naa faju ñu ngi ñëw di faju léegi nii mooy benn ci yum gis. Ñaareel si lum gis mooy ne ñi nga xam ne ñoom la moo jàngal demoon na sa beragal ne xëj na moom étudiant yam yi fële na li dinañ gis lii nii mere ko ci waaye mu ne loolu sax léegi nii soxalu ko waaye daal dafa wax dëgg bi rek mooy ne foofu noonu nu mu gisee étudiants yi ak fii nii duñ benn fii nii ñi nga xam ne ñooy jànga ñoom dañ am dañ bugg a daal jàng bi ñu ngi toppa bu baax a baax lan la ñu naa jàngal nekkul ne xaalis moo tax ñu jóg ñoom xam-xam moo tax ñu jóg bugg a dimbale seen askan moo tax ñu jóg moom daal kontaan na bu baax a baax te daf di bugg a ñëw fii nii at bu nekk daf dee yàkkamti pour ñëw pour gis ñi nga xam ne ñoom la ñoo jàngal parce que ñoom ñëpp ñu ngi ci def seen itte bu baax a baax a baax pour mun a jàng kon nag loolu man wan naa ko ne nag loolu kontaan te la si ñun parce que loolu mandargaam mooy ne ci kanam tuuti dinañ am ñoo xam ne seen xam-xam màcc na parce que ki nga xam ne moo ci am itte kooku la xam-xamam di màcc te suñu waxee ne moom ñi moo jàngal yëpp ñu ngi ci am ité bu baax a baax te lu tax ñu am si ité nekkul pour ut xaalis sax de waaye pour dimbale seen askan moo tax ñuy jàng bi nii kon loolu noonu lu dal xel la ñun ñëpp suñ xel kon dina dal ne daal ci kanam tuuti ci liggéey bi nga xam ne moom Alaaji ak Diane ñu ngi ko def dinañ fi am si ñoo xam ne seen xam-xam màcc na si lii ñun ñëpp kontaan nañ xam naa su ma ñëwaatee ci waxtaan bi ak Alaaji dinañ xam sax lu tax man ma gën see kontaan ci loolu noonu Kadijatu
mbadingol comme docteur ñinen karo ñina Diane la wolo keta ko ala taro Angleterre je ala karandiro fanna ñinna anin ay cool men kalamuta Angleterre je anin Gambia jang monomu fatan fansol ñinti anin ay minna cool soto jammi ya lonko aketa ay kontani cool tanin e kabring e be ila najang men keta Diane la jabiro ñinti aketa minti wolom aka akontanta bakele abe nyen karandiro min najang me ya lonko ay karandiro dati men tata sanji tan saba ko manto Angleterre banko nyen kan bari kulo mi ya lonko kabrita ta foye karango dati jang kaka mol karandi jang aketa kontani ku balti me ya lonko ayaje ko gambian dindingol mi ya lonko abe karandi kan imu molti mi ya lonko e lafta nyin karango lale adu mu fenete mi ya lonko e lafta londo nyin nale adu ya jele ko kulo mi ya lonko ni ya karan ise ila sate ma koy nole adi se la dinkiral ma koy nole fanan ako fanan aya jele ko fanan ko gambia kono jang nuntu akamala kom nuntu sanji tan saba ko man to Angleterre be no nyamen wolom ko mul ka silale hanin aya tara ko yenyin sondo me kurango so to men keta hakili kurango nyinti e ka silale fam pour ka finti mul kan bari kulo mi ya lonko ala korosiroto ko nyaato do man din doron mul be kala kulti mi ya lanke be kontandale ka finti nan foka je ko se jararo fana so to no nyamen a watola aya jele fana ko gambian dindingol nyin na karango nyum kulati mi ya lonko man tarake kan kodo nyin kan ka fodo mbata nga karanga pare nga doku nga kodo nyin nyine hani kom akama ko bantala banko nyin abe Angleterre sate men to abe nyamen ako bara mo woje dindingol tay min je dindingol to wolom bebe pareri ne pour kanyi londo soto adi bebe pareri ne fana pour ka sate ma ko mi yati naka kita kontane ku bat mi yati ne ko sinin sama nyaato do mondi mbe mol soto la jane mi yalon ko be kala gambian dingol leti mi yalon ko be karango nyilbe alaji ning dayan la compagnie be karandila foka je ko be kontan la nyame momo mi yalon ko yenyin sasa nyin soto nse fintina noy kan nyame ne foka je ko se demaro soto no nyama watola.
Thank you very much. Alaji, just a follow-up to that. I know that you've mentioned in your opening that you saw the need, you saw that there was a big gap, and that is why you came up with this idea. Just to tell us more about your MDI corporation, how many students do you have there? What are the qualifications that you need for somebody to be able to enter this program, and are you trying to extend this program to maybe give some refreshers to doctors, to nurses, because these are people who deal with, we know that mental health is different from physical health, but they come together sometimes. So you need to be able to, those who have physical health, to deal with their mental health issues at the same time and in the hospital. So are we targeting doctors and nurses as well? So it's a loaded question, but I'm sure you should be able to.
The partnership with MDI, we started in 2023. So that's when the recruitment started. It wasn't easy because it's something new. So we had quite a few challenges, but then the challenges in the sense people, it's just about education. To educate them, what is counseling? Because it's just like me, when I went to UK, I didn't know much about counseling. And I could remember when one of my colleagues said he was going for counseling, I laughed. I said, you are so weak, why would you go for counseling? But then because I don't know, and it's very similar. But then after we kind of did a bit of education around it, I mean, people started to build interest. And currently on the diploma program, we have about 17. And we have the new intakes who are due to start in January. That is the certificate course, because our classes are very small. We don't, like the 17 is 2 certificate classes that we combine. Normally it's around, maximum we look at around 12 students in a class, because again, we want them to focus and understand, because counseling is about knowledge, skills, and attitude. So those 3 are the key outcomes, if that makes sense. So this is what is going on now. So the new intakes are starting, I think we have about 9, starting in January. And then every year, we will be recruiting for a new start. So if anyone is interested, they can apply now. We have not closed it because it's an ongoing thing. They can join us.
So that takes us to the requirements.
The requirements, we look at, one is you must be 18 plus, age-wise, and then grade 12.
Okay.
Yes, grade 12. And this could be quite interesting for some people, because grade 12 counseling is such that we train you. You start from scratch. It doesn't matter whether somebody has got masters, you have grade 12 or GCSE or O levels. No, you all start. So that's why on our program, everybody starts at the same level. So we build it from there to go up.
Okay, so maybe just the question I asked you and the answer in Mandinka, but I just want to inform you that there's a video we wanted to play, but the technical team has just informed me that the quality is very poor and we may not be able to play it. But we can talk. You can talk us through it later. You can talk about it later. But the question I ask you now in Mandinka and your answer to it, then I can say it in Wolof.
Okay, comme Dr. Nyininka men wala mo yindi control la programme nying. Mol mel beje na karandi wolu mo jelle mu mo si sula munela pour ye trano programme nyin kono. Okay, ntola classo mo bukasia because nga men soto sign the diploma classo nyin nga mo tang ani wara wulalem. So nga mol soto fana melialon ko wol nyanta dati la January wo fanan halisa wo be open ni me yalon ko ye lafita pour ka join programme nyin to is in contact nole wala yeta MDI ye nyininka is still open pour isi taranoje programme nyinto nyamen adun isi sula men na wala nyintiko because killing na application form bala ika personal statements kele like we adikara through interview fanana and in the interview kamen jibe je bake wala nyintiko ito mari muna mula motivation oti pour kana ñu programme oto because wo kumma yata nye bakel ela motivation anin fanan daji ka sifale bela ite la an fanan kalong because ning atara bita placement na nyato for a character certificate sort of from the place janning ite ba datila ka moje pour yipsi même mako so e mari nyanta sanji tang ani sey sotola adu nyanta grade 12 sotola qualification oning then tolu si mako no len si karandino le pour yeta to any level because ntol curriculum nga design nyameng ntengo curriculum data through the same process so it's in line with the UK curriculum because make approval of men soto is the same like any counseling course in the UK they have the same curriculum, we have the same standard, we have the same scheme of work, we have the same CLRs, everything else is the same. So we man call antul bulu because na we experience soto because ntabe yin kono le for sanjitani lulu over now me alon ko be nyi doku kono so nimme alon ko ye interest soto je nga fo nyameng is in contact nole wala MDI contact ni tata je wol ba fole ni to mari be kafun wala ñu programme mo ma ñame.
Thank you very much Alhaji just in Wolof mbokk yi lu ma laaj Alhaji mooy yéen seen programme bi nga xam ne moo nekk MDI naka la dee demee ñaata élève ngeen fa am lan la nit soxla pour mun a dugg ci loolu noonu wan na ma ne nag ñoom comme niñ ko waxee si njëlbeen bi seen certificate bi mooy di same certificate bi nga xam ne di nga ko mun a amee foofu noonu ci Angleterre moom tamit di same jànga boobu noonu la jaar bi éega fi nga xam ne moom la éega wan nañu ne seen certification bi am na ñoo xam ne depuis 2023 ñoom fukk ak juróom-ñaar lañu woon waaye léegi ñu ngi ubbi nag waati pour ñeneen dugga si am nañ juróom-ñeneent waaye ba tey tëjaguñ wan nañu ne nag loo soxla rek mooy nga am fukki at ak juróom-ñetta soxla nga tamit pour def grade 12 ba jeexal grade 12 di nga soxla tam balaañ laa jël danañ laa interview seet la seetantalu ndax yow am nga xelaat boo xam ne di nga mun a dugga ci lii nii nekkul ne da ngaa ñëw rek ne nii la ñu dugal la nekkul ne ku nekk la ñoo dugal daal dinañ seen ndax kii nii am na pas-pas bi ndax nekk na koo xam ne su si duggee dina ko def naka la ko war a defee ba gis ne kii nii mun nañ koo dugal ñu door koo dugal loolu la wax daal mu ne léegi nii képp koo xam ne bugg naa dugga daal benn nga dem ci moom wala nga dem MDI man dama foog ne lu gën a yomba mooy dem MDI laajte ndaka ngaay duggee ci programme bi ñu dugal la ci programme bi nii we are going to open the lines now on 5050505 for anybody who wants to ask a question and please to the technical team to make sure that they pre-interview the callers so that we know we are going to talk about mental health today. We don't want to waste any time talking about other things. So 5050505 mbokk yi number bi mooy 5050505 képp koo xam ne bëgg naa laajte si mbiri feebari xel daal mun ngaa laajte parce que pour am ñu demee nii ci programme bi du dee bëri kon lii nii lu am solo la kat jatu ci Mandinka.
Mbadi ngol ni mel la fa commandiro kala ibe 5 05050505 le commandila pour ka kafuno nyin kacca ko nga di maro ke pour nga kacca ke mi ya lon ko be mabe la sondomo nin hakilo nyin na fanna nyin na men sa tinna ko na lun tangol nyin se jabiro di yalla no nyamen comme ala sula la nyamen.
Thank you very much. Now the other question is for both of you. I'm sure you will be able to talk about the video that you wanted to show us, which was to show on how psychotherapy is conducted, how people talk to their patients. But unfortunately, the video does not have a very good quality, so we could not play it. But I'm sure you will both be able to talk us through that. But my question is now for the professionals.
Yeah.
You know, I'm a medical doctor.
Yeah.
I did 3 months posting in psychiatry about 30 years ago. So I had some little training on psychotherapy and so forth. But it's so little that now when I have somebody that I need to talk to, I feel a bit uncomfortable because I know I'm not well trained to deal with that.
Yeah.
And I know Kadjetu will tell you the same thing among the nurses. And as somebody who employs doctors and nurses, yes, hello.
Hello, assalamu alaikum.
Wa alaikum assalam wa rahmatullah.
Thank you very much for this very interesting program. My name is Lamin Dabo. Are you hearing me?
We can hear you, sir. We can hear you. Go ahead.
My name is Lamin Dabo. I thank you for this very interesting program. I am a senior citizen of the country, and this is a big challenge in this country. We have mental health all over the country, and sometimes the attention given to them is so low, is so bad, and I feel, you know, more should be done to this end. So I am interested in the online program, so that as an elderly person who has been to university and gone through the profession, but still want to do some service to the community, to those people who are unfortunate in this kind of calamity, I want to give my support. How can I register on this online program?
Amazing, isn't it?
Yeah.
Yeah, this is amazing. You're just talking. You're saying exactly what I'm thinking about, because it's people like you, Mr. Dabo, that can even help more. I mean, somebody who has gone, who has master's, PhD in university and wants to help in this. I am sure it is something that that will be very useful.
Yeah.
Actually, that also echoes the question I was just about to ask now. So I'll just complete it so that both of you can give us your thoughts on that, which is that as a doctor now, I want a refresher. I want to be more confident talking to my patients about mental health issues before referring to a more specialized person. The nurse also gets the same problems, and as somebody who employs, if a nurse comes to me and say, yes, in addition to my nursing degree, I have a certification like this certificate, I am telling you without doubt that I'll employ that nurse before I employ another nurse that doesn't have it. No, it's true, because I know they will be very useful in dealing with situations in the hospital. So, Mr. Dabo's question and my question, your thoughts?
Mr. Dabo, thank you very much for your question. I mean, to be part of the program, you can, we have an online form which you can access. So I can give you the number. Is 7994460. If you call that number, or if you go onto our website, our email address is wayasct@gmail.com. That is wayasct@gmail.com. That would come to me.
We need to interrupt you because we have a caller. We don't want to keep our callers waiting. So maybe if the technical team can write that on the screen, wayas.ct. City
at gmail.com.
Our caller, hello caller. Oh, we've lost the caller. So if there's any possibility, yes, please.
I'd really like to talk to Mr. Dabo and just say, you are exactly the sort of person we need on the courses. A lot of my students, they have had a career and they want to do something. I talk about some of my students being entitled, but many of them have decided to leave a career, or they're retiring, and they want to give something back to their community, or they want to still feel very useful and have meaning and purpose. Many of my my students have been in their late 50s and 60s, and they have plenty to give back to their community. They have plenty of life and work in them. Hearing that you would like to do this, it's absolutely wonderful, and we would love to have you on the course.
Thank you. I think that's very very good. So what the follow-up question,
Yes.
maybe that is for you on this. I think she's answered it very well. Is that if, for instance, Khadijatu wants to do this course,
Yeah.
or if, for instance, Dr. Ja, I'm very busy, want to do this course, can I have time to do this course? How engaging is it? How much time do I need to be able to do this course while able to work at the same time? There's a caller. We'll ask the caller to ask his question before we go. Hello, caller. Wa alaikum assalam. Yes. Jërëjëf sa wàlla.
Yeah, am na lu ma la bëgg a laajte dama call sa hospital line bi waaye ku ma doon waxal dama ko ne aw ma patience pour book appointment waaye am na lu ma bëgg a laajte because dama bëgg a communicate ak yow regarding to IVF waaye dafa ne ma xaar mu call sa secretary bi waaye mu ne mënut koo jox so xaw ma naka laa la mën a gisee even if the 30-minute conversation is very important.
waaw no da ngaa ñëw si lopitaan bi rek soo ñëwee nga wax ak suma secretary bi di nga mën a am appointment tey lu ñoo waxtaanee is entirely different waaye soo ñëwee foofu noonu dinañ mën a gisee incha allah.
ok
waaw jërëjëf si call bi soo ñëwee rek soo waxee suma secretary bi na la jox appointment ma gis la. Yes, so the question, and technical team, please let us vet the calls so that we get relevant calls. Yeah.
Yes, one is, if I hear you correctly, is, doctors, nurses, how can they be
Somebody
on the
like
program?
Mr. Dabo, yeah.
Yes. So, yes, you can be part of the program, because the way we design the program is we take into consideration like people who are in employment as well. So 70% of the program is delivered online.
Okay.
And what we do is we do record every session, every class. We post it on a platform. So if you are not able to attend classes, you can go back and watch it. The slides are also posted there. We also have a stream, like in interaction space where students interact with us. So assignments and everything else is sent to students online. They submit their assignments online. We mark them. We send them the feedbacks online. So everything is documented.
Yes.
So they can always go back and have access to those information.
Caller, you are on. Hello.
Hello, doctor.
Yes, sir.
Alzo
Mbeka Dorong.
Ole.
Ebeje.
Eyo nin senge nin sasa nyama sasa. Na vida mo kan ti so mune mora ta wantero.
Very good question. I think very good question, Alaji.
Yeah.
Thank you very much. So maybe I'll get Alaji to answer that, if you may, first in Mandinka, because the caller is in Mandinka. Then you can now translate it in English, because I think it is also important for our English speakers. It was going to be one of my questions later, but the question is, what are the symptoms of mental health?
Oh.
And that's a very good question, because people don't really know. So yeah.
Yeah. So what's the name again?
I think I've missed his name, but
It told you, Madu.
you need to talk to your camera. Yeah.
Okay. Anyway, I mean ninka wala mo isalo no nyadile ko mo yin kwale aku osoto. So isi wala no nyame wala mnyindi ko kudantan beje because nying okay jata kendea sonde me kendea. Okay nina da sonde me kendea la falnala. Eka men jibe no wala kudantan tes maybe kusaba me alon ko wala sone ada. Hala niye moje ala miro falinta. Ake baro falinta, ake ko falinta. Yakala mo. So maybe ninga misalo dila. Komi mo me alon ko komi mbeka fo kari depressed ale wala kari ika akasilan ne purkata akafo kon komi anxiety. Okay, what can be certain? You understand? At some point for a marriage, you feel low, you feel sad. That is normal. Because hadama di on lete fongo sotom. But ning atata fo watila wato me alon ko ameta komi yaje ko ila miro falinta. Okay. Nte bedamen jang.
Alaji, will you be able just to pause while we take the final caller, please? Let's just take another caller because we don't have much time before we answer all the questions. Yeah, let's just take this final caller. Hello.
Hello.
Yes, sir.
Eyo ndela nga o nyine nga to ma tole de nyamina
Juma
pudi ni nyama do kura ngo bina mo kan no la ya ndela nga o nyine nga
ito di madu
Amadou Sow. Okay, thank you. So I think we'll pause the calls now until you answer this question. Then we can move on, because I think this question on symptoms is really very important.
Amadou abaraka bake komi nga akuma senu nyamen ning atara yaje ko moye falindiri soto amari la mira nyala yaje ko wo mira nya falinta nyado la mealon ko is negative komi kaje ko ni mobe depressing yala nga sinye mira ko nte nte man nafa soto nte nte ku keno la mola, I'm worthless, I'm useless, I'm a waste of space, those kind of things. Mol ko wo mira sifar soto fangwe. So niyo soto wo miro soto.
The extreme of society, isn't it?
Yeah. So yana jibeng niyo mari yo soto muna mala emotions because ika wole jibeng nante. Okay, tumando bato amari niyo sikuya, do beje asichara charia kamfala. Ye kumali fire de asikamfa. Okay, do beje maybe wo kamfa ning akebaro akamenke. Wala mnyindi ko ida asa fang jamfandi mola. Okay, ate tarala mol kono. Bare ni nata ntol la fanala ning yo itandin nako ntede nga kari jele bare nga ke baro na miro baro ntol nga jakal ku sotonje. So nka kudanta ne jibe. Nying for example aka sotong wati jumal, that's the frequency of these occurrences. Okay, then in ajibe the impact or the intensity komi aka amari ning tora nyadile, and aka the number, like komi lokmo kono wala tilo kono aka nyin kwale aku soto nyadile, because kukilimbe mental health yalong it's a state of well-being, either psychological, emotional, or social. You understand? So ni nata ajibe ko mbeko soton bari yaje ko nyin jamabe jenka yirkar wo kadame nata da fo lokum fula yaje ko ku kilingole be kekan ni marila ite buka kafu molma wala yaje ko ida amari katu kamfaring wala ala sanea saita koma komi abuke ku abuke ku baring wo be fadang fo ya mari nyininka because tumando beje aka sotonne mo kono me alon ko maybe alafta wala kala bari sa mare nyininka ani fana aka tara na lasilo kono aka tara lasilo kono because nimbe assessment o kala ko nyininka ni for like is there any mental health history in the family, those are some of the things nka me alon ko nka mo nyininka
I think so that I can grasp most of what you have spoken, we'll have to take it from there. And the time is fast going. We have barely 5 minutes and we'll need to start concluding on this. But very interesting topic. And you see the interest that it is raising among the viewers. I mean, they're calling, I'm sure the calls are inundating the technical team at the moment now. But it's something that we may need to do another program on this and talk about this even more. So I will try to say what you have said in Wolof. I think you have said it in such a way that even our English speakers have caught some of the things that you've talked about. So basically, I mean, somebody who has maybe you can say it in English what you've just said now, so that we can just in 1 minute just a summary.
Reference to what the question that was asked was, how do we know someone is experiencing mental health?
Yes, probably.
What I was just saying is we look at a few things. For example, whether there has been a change in how the individual's thought process, the emotions, and also their behavior. So these are some of the things. And well, that's not conclusive, because you also need to take into consideration the frequency, the intensity, the impact, the number, and also another one is exceptions. Okay? Exceptions are whether there were times that this individual has not been experiencing this, because again that would give you a very good indicator to say, okay, what was happening that time? Because you said this is, you have been experiencing this on day 1, day 2, day 3, but day 4 you have not. Yes. What was going on? So you explore around that as well. Yes. So but then it's all about change in our thought, emotions, and behaviors. So that's what we look at.
Yeah.
Can I say one little thing?
Yes,
one
please.
Little thing. When we're looking at mental health, that's what we're aiming for, mental health. What we're looking and trying to identify is mental ill health.
Exactly. Mental ill health, yes.
And it can be very subtle. And it builds and builds and builds.
It's sort of progressive.
And it's often the people who are around the person suffering from mental ill health who notice the changes more than the person who's experiencing it.
Yes.
So friends and family, keep an eye out, observe, and you have somewhere to come.
Yeah.
We have Wayas.
Wonderful. Wayas is here, and we are all happy to have Wayas here. And you'll be surprised after this program to get a load of people coming in now to look for a place to do this course. Because it's a very popular program, and many people are listening to it, and I'm sure MDI will hear from some of them. Mbokk yi lu ma laajoon Alaaji rek léegi nii wala sax benn ci ñu kool moo laajte naka la di xamee ne am na problème ci mbiri xelam bi so moom wax na ko ne ci anglais mooy ne naka la ñoo xamee ne nit am na problème mooy dina am naka lañ ko ooyee dina am loo xam ne daal change na ci xelaatam ci xelam ak ci lu ñu ooyee emotion mooy ne sa yëg-yëg daal nga xam ne koo xam ne daf daan kontaan all the time nga gis ne léegi nii kontaanatut buggut a nekk si nit yi munatut a jëflante nit yi wala mu ngi su demee liggéey du mun a concentrate si liggéeyam du mun a def daal lu mu daan def daan nag yokka na ci wax na ne nuñ ko dee di xamee lu ci ëpp yëpp mooy nit ki nga xam ne moom la dal yéena yi du ko dee di xam sax moom ci boppam ne am na problème waaye nit yim nekkal ay xaritam ay mbokkaam ay ñu moo liggéeyal ñoom ñooy commencé di seetlu ne kii daal nu mu meloon melatut noonu wax na ne tamit daf dee di commencé ndanka di yokku te loolu noonu ñu nekkaa moom rek ñoo ko mun a seetantalu kon lu moo ñaan nit yi mooy ñu seetantalu suñ gisee ne nit kii ni daal nu meloon melatut noonu ñu mun koo seetlu ñu dimbale ko benn ñu wax ak moom wala benn ñu dimbale ko naka la moo amee ndimbal ci mbir mi alaaji tam yokka na si ne yenn yi tamit daf dee dox ci ay famille dafa am ay ñoo xam ne si biir famille bi la dee dox daal mooy su ko kii amee xëj na keneen tamit am ko kon loolu tamit lu jara seetlu la foog naa ne léegi nii time bi almost mu ngi jeex si amuñ more than 2-3 minutes so léegi ni ñoo def rek mooy dina bàyyi alaaji mu njëkk a joxe final words then we will finish with you your final words and then we can close the program. So Alaaji.
Thank you very much, Doctor, for giving us this opportunity. I think one question that I did not answer was in reference to the doctors and nurses.
Yes.
We have got a program called Mental Health for First Responder. Okay. So that is specifically designed to kind of educate our doctors and nurses. So it's a 4-session. Wow. We run it over 4 days. That is something also we deliver in partnership with MDI. So we've started that. We've done one. There's another one coming up in December. But if any professional or institution is interested, you can get in touch with MDI. So that is a program, and it's also a certified one. All our programs have been tested. And once again, thank you very much. And I hope this would be something that we can continue doing online.
Yeah. Well, I can tell you that I most likely will be one of your students very soon because I am quite interested in this. So I will definitely apply to the December program if that is if I am going to be accepted in it. I think I have the right attitude probably to go. So Diane.
Thank you. Yeah, thank you so much. Thank you to you, to your Khadijato, thank you so much for being there to interpret. To the viewers, thank you so much for watching. Please apply to our courses. Do the counselling course. That would be really good.
Certainly.
Yeah, starting January. We would love to have you on that.
Well, I would love to be on that, and you know, certainly as a student on that.
Both of you.
So we thank you very much for joining us today on this program, and hopefully we should be able to, like you said, maybe one of these days have an online even, just a specific part of it, so that you can talk to us also about the counseling. We can get a better video about how the counseling goes, so that people are not scared, so that people are not, you know, intimidated by the fact that you're going to have a counseling session. So that is really very important. So thank you very much for being here. So Karjatu, you can say your goodbyes.
Mbara alla la mor ko nyimala bara fona le fana ko ni momo mi ya lonko ya akaytol soto adum fana mu moti mi ya ke lafta ka fala nyim programme o nyin kono e sitano MDI la yi ko me ya tinna ko se ka funo nyim programme o nyin kono fombe se ka funo nyama pour ka jata kende ya gana sabatin dinna banko kan ala baraka.
Thank you very much, Karjatu. Thank you to our guests. Thank you to all viewers and everybody who has called, and apologies to those who called and could not get online. But definitely this is a topic that we will try to bring in sometime in the future. Till next week, this is all we have for you. Mbokk yi lii rek lañ leen mën a amal tey di leen gërëm ci déglu bi ak si toppa boo leen ñu toppa fii ba beneen lundi incha allah.